Joining me now is the Surgeon General of the United States, Dr. Jerome Adams. Thank you so much for joining me today, Dr. Adams. Great to speak with you.
Really glad to be here with you.
I know that it's a tough time out there with so much going on with the mask debate, especially as we're seeing so many cases rise across the U.S. and continuing to do so. Could you tell us about what the logic is and what the thinking is at the federal level about not requiring a mask mandate?
Well, I appreciate you asking that because there is so much focus on whether or not we should force people to do something, and I think not enough focus on the need to educate people about why they should do it. Strictly from a public health, motivational, and behavior change perspective, it's important to know that we don't have much luck when it comes to trying to force people to do something if we don't couple that with the why. We know that if you force people to do it, they'll do it when you're watching, but then when you aren't watching, they'll stop doing it. We also know that shame doesn't work, and that's true for opioids. That's true for STDs. That's true for HIV testing. What I'm focused on as Surgeon General is helping people understand a couple of things. Number one, COVID-19 has really humbled us in terms of its asymptomatic spread. Really quickly, what that means is that previous diseases like COVID-19, other coronaviruses, really weren't spread by people who didn't have symptoms. You knew if you were sick, and if you were sick, then you were one of those people who was more likely to spread the disease. But up to 50% in many cases of people who are spreading COVID are spreading it before they have symptoms and without ever even knowing they have it. And that's why our recommendations change to tell people to wear masks or face coverings. The other important thing I want people to know is that masks actually don't inhibit your freedom. They don't inhibit your choice. They enable freedom and enable more choices, because we know that if we can get 90% of people to wear face coverings and get people to practice at least 6 feet of social distancing from their neighbors and practice good hand hygiene, that we can reopen and that we can stay open and we can get back to schools, to worship, to college football in the fall, and to the other things that people want to do. You'll have more choices if you wear a face covering.
There has been some debate and comparisons about, seatbelt enforcement and other things like that. Would you say that those are fair comparisons, and that even if at the state level there should be some level of enforcement?
Well, I'm not opposed to mandates at the state and the local level. We actually support local control and state control. Here's the concern when you talk about enforcement from a federal level. And this is a very...
As President Trump invoked the Defense Production Act to get every commercial lab up to speed, has the Trump administration invoked the Defense Production Act to get contact tracing up to speed? There are millions of unemployed Americans who could be working at labs and doing contact tracing. That's what I mean, a Manhattan Project-like effort.
I think that's exactly what we've been doing. The Manhattan Project-like efforts being led by the Vice President of the United States, with the top officials from multiple sectors meeting multiple times a week and literally 24/7 since this has started. We've invoked the Defense Production Act numerous times. We've invested in multiple different technologies. Every single day I have a working group looking on how we can invest. That's something that we do, and you'll see more investments coming later today. We improve the outcomes of testing, like point-of-care testing, so we can improve that to get every 15 minutes. Really, everything that you're talking about, there was a third point that you mentioned. I'd hope you repeat it, because I forgot that third point you mentioned, but on the investment.
Contact tracing.
Contact tracing. Yeah, thanks. So look. We sent $10.25 billion to the states to support their state plans. Now, we have outlined all the requirements that have to put in the state plan. We assess them, we adjudicate them. That's $10.25 billion to hire contact tracing. They have plenty enough money to do that. As of last week, of the $10.25 billion, there's only been $50 million drawn down from that $10.25 billion from the states. So there is money there for them to do it. We have sent coronavirus response assistance teams that will also help with that to 26 jurisdictions in the last 2 weeks, another 6 this week, and we have CDC personnel in every single state. So we are supplying the technical assistance, the money is there, the state plans have to meet requirements. So I think we're checking all those boxes that you just said.
So I'll talk about contact tracing in a second, because it's a good point that you just raised. But here's the thing. With all due respect, It's July, it's almost August. We're months into this pandemic, and we're still hearing about testing problems. In California, where the virus has been unrelenting for months, we've seen week-long turnaround times, hours-long lines for access to tests. Officials.
This morning, a nation in crisis. Florida seeing over 1,000 people hospitalized between Friday and Saturday, on track to overtake New York with the second highest number of confirmed cases in the United States, trailing only California, where 440,000 people have tested positive for COVID-19, and experts cautioning those are just the confirmed cases. The actual count is likely to be in the millions, with younger Americans now getting infected at alarming rates. On Friday, the Los Angeles Police Department announcing the death of Officer Valentin Martinez, a 45-year-old expecting father of twins, one of over 400 members of the LAPD to have come down with COVID-19. So far, the governors of California, Florida, and Texas have held off on ordering another full shutdown. Dr. Anthony Fauci saying some states need to do more.
You don't necessarily have to go all the way back to a complete shutdown, but you certainly have to call a pause and maybe even a backing up a bit.
But over 500 health experts across the country are demanding that the Trump administration order a nationwide closure, saying, quote, shut it down now.
We need bold action now to save lives. Otherwise, we're just going to keep going through this cycle over and over again.
But even in states where shutdowns have been limited to places like bars, protests continue, like in Texas, where on Saturday, some bars opened their doors against the governor's orders.
We're trying to show that we can open up safely and operate.
On Monday, Indiana will be instituting mandatory mask requirements. 2 children there who lost their father to COVID-19 are speaking out.
You're not pro-American if you're not wearing a mask. You're pro-you. You're not treating your other Americans with respect.
Please wear a mask!
And in Santa Monica, activism from the elderly, where a group called Grannies for Masks are taking to the streets with bullhorns to remind people of the dangers.
Please wear a mask. Grannies don't want to die.
And Willie, it looks like we may see some progress in the next round of COVID-19 aid after the $1 trillion proposal struggled to get through Washington last week. Treasury Secretary Steven Mnuchin saying Republicans are hoping to roll out an aid package and stimulus checks for Americans next month, and saying extending the unemployment benefit is of top priority. But there still seems to be some disagreement on exactly how much that unemployment benefit should be. Willie?
Well, let's hope they move quickly. A lot of people need that money. Gotti, thank you very much.
Fifteen states setting weekly records for cases, 9 reaching new highs in deaths. The disease now infected more than 4.1 million people in the U.S. and killed more than 146,000, with more than 59,000 in hospitals.
Globally, cases have topped 16 million.